Welcome to the instructional video for the VN Cares anemia screening. To set up your station, make sure to lay out the following materials: the anemia screening log, box of gloves, chem wipes, sharps container, the HemoQ machine, a cuvette, the lancet, a cotton ball, an alcohol swab, a Band-Aid, and a paper towel. This is the falls risk form. To qualify for anemia screening, the patient needs to have 4 or more fall risk factors and be 65 years or older, or have had a previous history of anemia. The falls risk factor must be completed by BMD first. If the patient has not gone through BMD screening, politely redirect them. Greet the patient and take her falls risk form. Make sure that the patient qualifies for screening. Fill in the patient passport number, age, and number of risk factors. To check for nail bed blanching, place pressure on the patient's fingernail for 2 to 3 seconds. Write down yes if the nail does not turn pink immediately, or no if it does turn pink immediately. To check for conjunctival pallor, have the patient pull down their bottom eyelid and examine the coloring inside the eyelid. Write down yes if the coloring is pale pink to white, or no if the coloring is red. Turn on the HemoQ machine. If it's the first screening of the day, clean the shelf with the alcohol swab. If it's not, clean the shelf with the chem wipe. Prepare the work area by putting on gloves, opening the Band-Aid, and opening the cuvette packet. Note the circle near the tip of the cuvette. For accurate results, make sure the circle is filled with the patient's blood. Alcohol swab the patient's finger and let it air dry. Prepare the lancet. Massage the patient's finger to stimulate blood flow before using the lancet. Immediately dispose the lancet into the sharps container after use. After the patient starts bleeding, wipe away the first drop of blood using the cotton ball. Then place the cuvette tip on the drop of blood and fill up the circle completely on the first try. Place the cuvette in the machine and close the shelf. The machine will then give you the hemoglobin levels. Wipe away any of the patient's excess blood before bandaging their finger. Place all the trash on the paper towel. Then ball up the paper towel in one glove. Properly dispose of the materials by turning the gloves inside out and placing them in the trash can. Make sure to properly dispose of the lancet and the used cuvette in the sharps container. Read the hemoglobin levels on the HemoQ machine. Record the value on the log. There is a reference table in the resource binder showing normal hemoglobin ranges for men and women. Give the patient their consultation with the preceptor and be sure to let them know that this is a screening and not diagnostic. After every screening, make sure to clean the shelf with a chem wipe, and after the last screening of the day, make sure to clean the machine with an alcohol wipe. Let it air dry. Turn off the machine and place it back in the cooler. Thank you for watching!